Hey, good afternoon. It is JK live on location at the National University Health System. I've tried my very best to dress up like a doctor today, as you can see, but I have the real doctor on my right. He is Dr. Mok. Good afternoon, sir. Dr. Mok Xiaofeng is an associate consultant at the National University Health System, also alumni of the NUS Yong Lu Lin School of Medicine. Today we are talking about something that our parents talk about, grandmas talk about. My wife has been nagging me every day about this, about my health, about eating properly, exercising more, because diabetes is a big factor. Tell me more about diabetes.
So diabetes is a chronic medical condition that's marked by high blood glucose in a patient. It's usually caused by either A, the body's inability to produce this hormone known as insulin that's produced by the pancreas, or in instances where the body does not respond to this hormone appropriately to bring down blood glucose.
Okay, so I'm hearing all these words that I have no idea about. So what I do know is that there are different types of diabetes. Let's find out more about that. What exactly are the different types and what do they mean?
So broadly, there are two types of diabetes, type 1 and type 2. In type 1 diabetes, this occurs mainly in younger patients under the age of 30. This occurs when the body produces little or no insulin, and therefore such patients will require insulin injections for treatment. In type 2 diabetes, which is actually the more common subtype of diabetes, it usually occurs in older patients above the age of 30 and is usually related to problems such as weight gain, and a sedentary lifestyle. So the body actually produces insulin but is unable to respond to it, and this often relates to the underlying problem, obesity.
So how does it happen? So the body is producing insulin, but yet your body cannot respond to this. Do you know why?
So there are several factors. What we do know is that usually in patients who are obese, the obesity itself triggers a sequence of events in the body leading to inflammation, which is long-term and chronic, and this dampens the body's ability to respond to the insulin. Hence, patient gradually develops higher blood sugar levels in the body.
So it is very possible that, let's say, the whole history of my family, way back until 17th century, they never had diabetes before. Because, let's say, me, Choi, if I'm eating too unhealthily, I'm not exercising, I can actually get diabetes, even though my family has no history of it.
Absolutely, JK, you're right. So patients who have had no history of diabetes within their family, if they lead the wrong type of lifestyle, they definitely are at increased risk of diabetes as well.
This is quite scary. I need to go back to my gym. Also, at the very same time, I want to ask, let's say I have diabetes. My family has no history, but I went to the doctor, did a body checkup. And how do they detect for diabetes? That's the first question.
So if you go by symptoms, a great proportion of patients with diabetes actually do not experience much symptoms. If you go by statistics based on, for example, the National Health Survey conducted in 2010, amongst patients aged 18 to 70, we know that 11% of Singapore population has diabetes, out of which actually only 50% of patients were diagnosed, which tells you that a lot of them actually did not know that they have diabetes. In terms of how we make the diagnosis, usually we will have to do a test, a blood test, what we call venous blood sample, where we actually do venipuncture for you, and when we detect high blood sugar level, it usually confirms the diagnosis. In some patients with milder levels of blood glucose, we may have to subject them to an oral glucose test, whereby they drink a sugar drink, following which we do a venous blood test. That's how we make the diagnosis of diabetes. We definitely do not make use of tests such as testing of the urine or a finger prick test, because those tests do not give us accurate results to make the diagnosis of diabetes.
All right, that's a very, very good answer. Also, two questions I'd like to ask right about now. Regarding, let's say, number one, I do not have diabetes, no history, but I want to avoid having it. What can I do? That's my first question.
So diabetes is definitely preventable, and a lot of it, as you figured out, is by adopting the right lifestyle. So we usually advise general population to consume a healthier diet, lower in overall calories, less fat, less oil, lower carbohydrates. Usually for the specifics, we will enlist the help of our dietitian colleagues to help them. Physical activity is very important. So exercise, usually about 150 minutes of moderately vigorous activity over 3 days a week, will help to keep a person healthy and maintain weight loss. In patients who are actually trying to achieve weight loss, we will generally advise reduction of weight of about 0.25 to 1 kg every month to achieve an ideal body weight based on a BMI of less than 23. So this can help reduce a person's individual risk of getting diabetes.
Hashtag eat clean, hashtag train dirty. Also, final question. Let's say I have diabetes, all right? Is it possible for it to go away? Or at least lower the symptoms or lower the chance of it progressing further? What can I do?
So absolutely, patients with diabetes, apart from adopting the previously mentioned lifestyle changes, where necessary, they can be started on medications. And as long as they maintain a good level of blood sugar level, they can continue carrying a very normal lifestyle. In the long term, what we are trying to prevent are long-term damage to blood vessels, which can lead to complications such as heart attacks, stroke, kidney failure, blindness, and even damage to blood vessels to a leg, which may necessarily, which may require amputation. So as long as a patient control all this and try to improve blood glucose, they can improve their overall life quality. Some patients can reduce the amount of medications that they take, although they may not completely come off it, but usually with adopting the right lifestyle, they can reduce the medication to a minimal level.
Well, we've learned a lot today from Dr. Mok. Before we go, any last messages from our young listeners, our young people watching right now, in order to avoid diabetes in older age? What would a doctor right here, what would you say?
I think the best advice we can give is that prevention definitely is better than cure, because diabetes is a chronic disease for which we don't really have a cure. So right now what you can do is to really adopt a good lifestyle. Don't push your body too hard by abusing it with poor diet and a lack of exercise. So hit the gym, go and take out a run, and agree to have a good healthy diet. By staying in shape, you are giving the body the best possible chance of avoiding diabetes.
You're gonna spin me around.